Assalamu alaikum wa rahmatullahi wa barakatuh. Today we want to explain the shock, and we mean the cardiovascular shock. And we must know firstly that the cardiovascular shock characterized by hypotension, that means reduce of blood pressure, and this is due to diminished of cardiac output. That means in cardiovascular shock, there will be a decrease in cardiac output, maybe sometime reach to diminish, that completely stopped of the heart from pumping blood. And also there will be inadequate quantity of blood that supply the tissue. And we know that if we have a reduction in the effective circulatory blood volume, that the tissue cannot receive a sufficient quantity. So this is merely to impaired perfusion. Perfusion means the less supplementation of blood to the tissue. And we know from this that this is lead to hypoxia, and hypoxia may lead to ischemia, and we know from the cell injury that ischemia, the output of ischemia may be lead to loss of function of the organs, or maybe it lead to death. And according to that, we can classify the shock into many type of shock. We have what we call it cardiogenic shock. That means the main source of this shock is the heart. And we have the hypovolemic shock, reduce of blood volume, and also we have the shock which associated with inflammation. Also we have a septic shock, and we have also less common shock like a neurogenic shock or anaphylactic shock. We explain it later. Now, cardiogenic shock have many causes. Maybe we have intrinsic causes that lead to the heart itself, and this is maybe we have myocardial infarction, or cardiac arrhythmias, or cardiac myopathy, or sometime rupture of the heart. This is intrinsic cause, that the main cause is the heart. And sometimes we have extrinsic cause, that is from outside the heart. This is maybe cardiac tamponade, as there was a fluid or over compressed over the heart, or if we have obstruction to outflow, and this is also lead to the reduce of cardiac output, and this is maybe lead to hypotension and to shock. And sometimes the cause may be pulmonary embolism, and we know that if we have pulmonary embolism, there will be less retain of blood to the heart, and also it may be lead to edema, and edema also maybe lead to that mean reduce of blood volume, and also lead to shock. And also if we have obstruction to the outflow, that means there is the heart cannot pump to the blood vessel, which is the passage of blood to the tissue, and so there will be inadequate blood that received from this tissue, and maybe it lose its function, and maybe finally lead to the shock. And also we have other causes, as I say, maybe pulmonary embolism, or valve thrombus, that will be thrombus in the valve, and this is also lead to reduce the cardiac output, and sometimes tension in pneumothorax. The hypovolemic shock, this is mean reduce of blood volume, and this is maybe related to loss of blood or loss of fluid. And we have in many cases we can reach this situation, I mean hypovolemic shock, and reduce the cardiac output, and then we enter the hypotension situation, and maybe we are in shock if we have acute hemorrhage, and hemorrhage maybe from injury or trauma, or sometime in post-portal hemoglobin after parturition, or sometime if we have bloody diarrhea or bloody cough, all these maybe reduce the blood volume, and we as we call it hypovolemic shock, reduce of blood, loss of blood. And also maybe acute pancreatitis or excessive use of diuretic, that means lose of fluid. As I say, the hypovolemic either reduce in blood itself or reduce in fluid in cases of edema, that the fluid escape from the blood vessel and lead to hypovolemic shock. Also, here we have what we call hypovolemia. This is direct loss of effective circulation blood volume, and here we found many signs like rapid and weak thread pulse, that we have a weak pulse, and also we have a cold and rapid shallow breathing and hypothermia and rest and dry of the mouth. All these we found these clinical signs in case of hypovolemia. The third type of shock is shock associated with inflammation, and we know that inflammation lead to vasodilatation. This is related to secretion of histamine, and vasodilatation lead to escape of fluid from the blood to the interstitial spaces, and so we have hypovolemic shock, and this is also lead to the decrease of blood volume, also cause decrease in cardiac output. As I say, we have other type of shock like septic shock, and this is caused by microbes, and also they call it endotoxic shock. Also, we have the less common shock like neurogenic shock. This is related to nervous system disorders, or anaphylactic shock. Anaphylactic shock also lead to shock because in anaphylactic shock, I mean allergen. This is also we have bronchial constriction, narrowing of the bronchus as an asthma, and this is lead to vasodilatation, and we retained another way to lose fluid from the blood, and lead to hypovolemic shock and reduce the cardiac output, and also lead to hypotension and shock. The stage of shock, we have the initial stage. This we can pass it if we if it is reversible, and if we cannot treat in this stage, we enter the compensatory stage, and also if we cannot activate the mechanism that lead to retained again to the normal case of the heart and the blood volume, so we enter in the progressive stage, and this is very danger, and this is mean the failing of the compensatory stage, and here we have ischemia and lactic acid production, that means we have acidosis. And finally, if all these stages were failed, so it becomes irreversible and may lead to hypoxia and cell necrosis, and then it may lead to death. The outcome of systemic shock, we have systemic lactic acidosis, decrease in myocardial contractility, and decrease of vascular tone, as well as decrease in blood pressure, preload, and cardiac output. So we can summarize this in many words, that we can concentrate our information in the cardiac output, that when the heart cannot pump a sufficient quantity to the circulatory system and reach the tissue, so the tissue will lose its function due to hypoxia. And thank you very much.